subscribe and join the HOHO family!
Hi dear HOHOs, it's Happy Thursday. So today I'm taking the time to tell you guys about what has been happening with me for the past 1 week. Actually, even prior to 1 week, I was pretty sick, down with a bad flu, which caused me to be on 4 days MC. I was telling you guys that I have been feeling quite bad because it seems like it's quite a little bug and I really didn't want to take any more MCs because I'm still on probation. So what happened was on Sunday, I thought I was recovered already because I stopped coughing. So I was taking my temperature over the weekend and things were normal. I wasn't having a temperature, having a fever. And on Monday itself, in the morning when I took, in the morning it was 36.9. The morning before I left for work, and then at work I took again and it was 37.1. And this was still in the morning, so I felt alright. I wasn't coughing, I wasn't having a fever, I had no other symptoms. So I was just working as per normal. And after lunch, we had to do another temperature take because we are supposed to take twice a day. One in the morning and one in the afternoon before we leave for work. So in the afternoon, I took my temperature. So funny thing is, I remember it was around 1+1-ish, and then I just had a sip of hot coffee, and then about 20 minutes later I went to take my temperature. It was a 37.6. So back then we all thought maybe it could be because I drank a sip of coffee. We decided to wait for more than half an hour to 40 minutes later, and when I took again it was 37.7. Quite scary for me because our protocol is for me to go to the emergency department if I am deemed with a temperature of 37.6 and above. It actually took about 10 times because I didn't want to go to the emergency department, so I just rested, cooled myself down, and I took, but my temperature just kept increasing and eventually it was a it was a 38.0 degrees Celsius, and I decided that I had to be responsible, so I had to go down to the emergency department, which I did. From there on, things just start to escalate, as in, so I went down to the emergency department and they had their temperature taking. So when they took my temperature again, found that I had a fever, I was immediately isolated, put into the isolated area. The healthcare professionals were trying their best to attend to all of us. Everyone was like coughing, we were all febrile. It was pretty scary. Within the isolated area, there's also isolation rooms where I saw there were about 8 rooms, and about 8 rooms, I think about 5 to 6 of them were actually occupied, like maybe deemed to have pneumonia after the chest x-ray, and they probably had to do more swabs for the COVID-19 virus. So for me, when I was escorted in, I was immediately given a seat and alphabet plus a number, and that was my identity. I waited to see a doctor who did history taking before asking me to go for an x-ray to check if my lungs are clear, to verify whether I have pneumonia, and also because I am a hospital staff, so they definitely cannot take any chances because I work very closely with the healthcare professionals and I also see patients. Thank goodness the x-rays were clear, my lungs were clear, but because I was still having a fever and I've had symptoms of upper respiratory tract infections, I wasn't coughing back in the ED actually, but that night I actually lost my voice again and I had lots of dry cough and sore throat again. The instruction was, after discussing with the infectious disease doctor, the emergency department doctor told me to do a swab in my in-house clinic that serves our hospital staff. I was given 3 days of hospitalization leave so that I could return to the in-house clinic the next day in the morning to do a swab for the COVID-19 virus. Honestly, I wasn't afraid that I would get the COVID-19 virus because I felt like it was just a normal flu, and thank goodness my lungs were clear. I was more afraid of being in the emergency department because everyone seemed quite sick and I was worried if I would catch it. I was just given a surgical mask. Then again, I thought about the other colleagues, healthcare professionals, the doctors, the nurses, they definitely had their full PPE. They wore visors, they wore the N95, they had their scrubs, they had the gown, they had gloves, but they were there for prolonged periods of time, so I was pretty worried for them as well. Actually, I wasn't afraid that I would get the virus, COVID-19. I wasn't afraid that I had the virus. I was more afraid of contracting the virus from being exposed there for a couple of hours. I stayed about 1 to 2 hours there. Unfortunately, not too long. I went home and the next day I went to do the swab. A little bit of a misunderstanding. The in-house clinic didn't have the swab, so they had to call the emergency doctor, the infectious disease doctor, to find out what's happening because they were not expecting me to come, and I guess they were quite afraid if I had the COVID-19 virus. They were not prepared. So what happened, I was just in the room. I was isolated in a doctor's room. We're just waiting for them to sort things out, and the colleagues were really very nice. So instead of sending me back to the ED, which they did for my future colleagues who were referred by the ED to the in-house clinic, they actually accepted me and they got the swab for me, which was really sweet of them. So I didn't have to move back and queue up and wait all over again. So I did a swab, and yesterday I waited for the results to be out, and luckily I was deemed to be negative, status negative. So the bad thing is because I've still been having a fever, so the doctor did say like if tomorrow by Friday, if I'm still having a fever, then I have to do another swab back at the emergency department to rule out COVID-19. I guess there are a lot of cases of like false positives, so false negatives, sorry, yeah, my brain's not really working right now. So false negatives, yeah. So I'm just monitoring and taking my temperature. The doctor will call me on next Monday, to make sure that I'm well. If I'm well, then I can return to work on Tuesday. The doctor is just trying to make sure that I do not spread any viruses, even if it's not COVID-19, even if it's a normal flu virus. In this time of crisis, we cannot get the healthcare professionals or the patients or the caregivers sick, or about exercising social responsibility. So I've literally just been like sleeping at home. The medicine is pretty strong. I feel pretty unwell, pretty sick. Just hope to get better very soon, and I hope that it's just not COVID-19, because yeah, I just don't want to spread to John and to my other colleagues and my other family members as well. So yeah, that's it. That's my status update for today. So I'm just gonna monitor myself, and I'm thankful for everyone who has shown their concern for me, given that I've been on extended hospitalization leave. So thank you my colleagues, thank you my family, thank you John, and thank you God for protecting me. So yeah, let's just work hard again to fight this virus, everyone. There's been like 50 cases already in Singapore. The number of locally transmitted cases far exceeds the number of imported cases. So I hope that everyone can just stay healthy. Yeah, once again, let's beat the virus together.